And for individuals dealing with behavioral health issues, particularly substance use disorder, we know that those deficits are so much more prevalent and such a factor in their ability to engage in their care.
We're going to jump right into these questions from the audience. Tell us a little bit about your background and how you became involved in integrating recovery housing and clinical treatment service for substance use disorder within the field of healthcare.
Sure. But first of all, just thank you so much for the invitation to be here today. It's an honor and a privilege. I'm so glad you asked this question first, because this is a topic that I am so passionate about, and it really has a highly personalized component. You obviously know a little bit about me from a student perspective in my work at CGI, which has been fantastic, and so excited to be near the finish line there. But it definitely wasn't a straight line journey getting there, or to being in the behavioral health field. I'm a person in long term recovery. And what that means for me is that I had my own lived experience dealing with a substance use disorder and some other co occurring conditions. And I was very, very fortunate to have family support and have some resources in place that got me the help I need. But I will tell anyone who will listen that the turning point in my own story of being able to sustain a recovery pathway was when I was sent to treatment in the state of Minnesota.
Mm.
And I was given the recommendation to reside in a sober living or recovery home for a year following the treatment experience.
Okay.
I will note that was the first time I ever followed the medical recommendations that were given to me after treatments. And living in that setting gave me the opportunity to actually practice what I had learned and to put it into kind of daily application, to learn how to be accountable, to learn how to be a person who shows up, and
Hmm.
to, employ the tools I'd learned.
Right.
So, fast forward during that time, I also decided I would go back to school and try and give back.
Okay.
And that's kind of what propelled me into the field, and also kind of informs why recovery housing to me is such a critical part of the continuum experience.
What has been your journey in integrating recovery housing with other healthcare disciplines to address substance use disorder? What motivated you to pursue this path?
Yeah, so that too is kind of an interesting part of the story. I went back to school and was pursuing my master's degree in co-occurring behavioral health. The
Mhm.
result of that is I'm now licensed in both substance use disorder and mental health treatment as a professional. But during that time period, I was also asked to come back and run the sober living organization that I had once resided in. And so my day job, when I wasn't in school, was overseeing 10 different locations and over 120 beds for individuals in recovery. And it was great to be overseeing environments that kept them safe. But what I recognized is many of them needed additional resources. And so that was my very first opportunity. I approached the owners, and they allowed me to license a clinical substance use disorder program under the Umbrellas organization that started providing care to the folks in housing. And that was kind of that initial experience for me
Um,
of synthesizing the two.
how have you incorporated and prioritized recovery housing in integrated care models for substance use disorder, and how was that impact on patient outcomes?
Yeah, I mean, I think that is kind of the seminal question in considering this integration.
Mhm.
We throw around a lot of fancy words today, social determinants of health,
Right.
and all of those kind of things. But it was great to be reminded just a couple of days ago, Minnesota's own Governor Walz in his acceptance speech for
Yes.
Vice President of the United
Uh-huh.
States noted that um, healthcare and housing are foundational human rights, right? So, I think we all know, Maslow and all that. Like, if I don't have a place to sleep tonight, it's hard for me to think about how I stay sober and how I come to treatment.
Right.
So, I think we all know that intuitively, but we need the data to back it up to continue moving forward with innovation. And
Hmm.
so I was recruited from that first effort at the organization I was with called Transitions to my current employer, a
Hmm.
nonprofit called NUWAY.
NUWAY.
And NUWAY was at that time, you know, a kind of icon and pillar in the Minnesota community, been around over 60 years already, with a mission statement of providing safe environments for individuals in care. Right. And so the next step in that was, how do we continue to expand the continuum?
Hmm.
And the way I started to integrate community recovery housing was one of those fortunate accidents, just like the ACE study came out of some data from an obesity program, right? That we weren't trying to change the world. We
Hmm.
bought a building and we were going to let 60 patients live there while they came to outpatient treatment. And the next door neighbor said, no, you're not. And we
Wow.
had to chart a different path on the fly. And because of my prior experience in the recovery housing industry, I was able to reach out to some colleagues and say, hey, we've already allocated resources to do it one way. Let's try it a different way. Let's try a partnership.
Hmm.
And that has really changed the course of how we are able to deliver care. And I was able to see that immediately. I think the great thing is, so was our board of directors over time. And,
Hmm.
to have a nonprofit board say, hey, let's commission a big longitudinal study. That doesn't happen all the time, but that's exactly what we did. So we partnered up with the University of Minnesota and are 5 years in now with over 7,000 patients
Wow.
enrolled in a
Wow.
study showing exactly what you asked, the data that shows the folks who are utilizing the housing component versus those who aren't are achieving better substance use recovery outcomes, better mental health outcomes. And we're using a measure that kind of looks at recovery capital. So better overall life outcomes, which is fantastic and very useful, right? For all kinds of legislative and payer discussions and so on and
Right.
so forth.
Right. Right. You kind of tapped on this a little bit, though, but what are some of the biggest challenges you've seen faced in integrating recovery housing for USD treatment in traditional healthcare settings, and how did you overcome them?
Yeah, I mean, I think this is a really pertinent question in today's landscape in particular. So, again, like the idea of pairing housing and some sort of clinical care isn't new. I mean,
Hmm.
that's essentially what partial hospitalization is,
Right.
or, outpatient with lodging and those kind of things. The opportunity I have has put a little different spin on that, but I think the barriers are the same, and are maybe getting accentuated more. You look at state and other regulatory opportunities for housing, and you find that there are often so many barriers and so many hoops for patients to jump through.
I can only imagine. Wow.
Yeah. So
Yeah.
the model that we use has kind of bypassed a lot of that.
Mm.
And because it doesn't fit within that kind of accepted category, it
Hmm.
gets looked at. And, these are the things that frustrate me. So, you
Mm.
know, we would think in this field, we should all be rowing in the same direction. But if, we're doing well because of innovation, folks who aren't forward thinking are going to critique and criticize and point to it as an unfair competitive advantage and
Mm. Wow.
those sorts of things. I think another key barrier is that you've seen some pretty high profile examples around the country. Florida, California come to mind, a big thing called narco freedom that happened in New York City. And these were all cases of lots of fraud, waste, abuse, bad behaviors that also involved recovery housing in some way. And for the general public, that all just goes under the same tents and gets painted in a bad light. So I think, education about that value is a real barrier.
Hmm.
And, even where we are today, being better educated and more proactive and more diverse, there is still such a huge amount of stigma around substance use disorder and mental health. And that brings out kind of that NIMBYism in places where we want to locate care. The example I gave you about, our
Right.
opportunity,
Hmm.
not in my backyard, right? And that's a battle we'll be fighting for a long time, I think.
Right. Right. What innovative approaches or best practices have you or others implemented in integrating recovery housing, and what results have you seen?
Yeah, so I think one of the key things that was important about that model we switched to of community partnership is it provided a lot more empowerment to the population we were serving. So
Okay.
if we had gone with that original model of having a building with 60 beds in it, when
Hmm.
you were done with treatment, I would have had to say, hey, it's time to move on because we need that bed for the next person who's actually in treatment. In this alternative partnership model, we were able to work with many, many providers who ran the programs. They had nothing to do with the clinical work that we were doing.
Hmm.
That meant that if I'm coming for clinical programming, I can choose wherever I want to live out of all of those partners. I don't have to go here. It's not, the clinician who's saying that, it's the patient who's saying, yeah, that's a good fit for me. So I think that opened kind of a different aspect of choice for a patient. And then also, as part of that model, we committed to a post treatment subsidy to bridge that continuum gap. So they can stay in those settings for up to a month on their own um, 2 feet and then take responsibility if they want to continue staying in those settings. And so it's changed a paradigm in a lot of
Hmm.
ways. And we're not the only ones doing that. I'd love to say, hey, I'm a genius, but this is common
I
sense.
think
And
you are. I think you are. So.
as soon as we started doing that, we saw a lot of other providers in the field say, hey, wait a minute, what a great idea. And so now that's a pretty common model, at least here in the state of Minnesota.
What future innovations do you see in the integration of recovery housing with clinical treatment services, and how could this impact the entire healthcare industry?
Yeah, well, at CGI, we're always thinking about the triple and quadruple aim, right? And I think
Yeah.
this fits squarely into those conversation in
Hmm.
terms of how we can continue to provide better care and get better outcomes while also reducing costs. I think there's three key things I would think about to kind of tie this all together. One is that the American Society of Addiction Medicine, ASAM, in
Hmm.
their newest iteration, their fourth edition, have now included recovery housing formally as part of the continuum of care. That is a huge
Yes, it
shift.
is.
Up,
Yes, it
up
is.
until this time, it's always been kind of this in the shadows resource
Hmm.
that people know about. But now they're saying not only is it important, but it's a critical part of integrated care.
Absolutely.
That's a lot of validation. And they worked very closely with NAR, which is the National Association of Recovery Residences,
Hmm.
to really make sure that that was thought out and included in this fourth edition in a meaningful way. I think in parallel to that, you're seeing now that a lot of state demonstration waivers,
Hmm.
the 1115 waivers, are including housing as a part of what CMS will pay for, and that too is really shifting the paradigm. And I think kind of the third leg of that stool is the payers being able to see
Mhm.
the value of integrated care in this way. I know we talk a lot about value-based
Mhm.
care, and we're not
Mhm.
as far along as I think everybody is talking about in public, but that's the direction we're going. And so being able to package resources like this and demonstrate outcomes is going to be what payers want to see and how they negotiate
Absolutely.
contracts. And for providers, that's how we're going to have to shift to move forward. So I think there's some pretty significant things going on in the field and across the landscape right now that are all generally positive for continuing this as an integrative journey.
Wow. Well, I tell you what, Ken, thank you so much for taking your time out today to answer these questions, these riveting questions that we've been wanting to ask you for some time now. Very sound with responses, very insightful, and we, just simply thank you for taking the time to speak to us today. And let you know that I'm a fan of your work, period. So, and always kept my eye on the different things that you're doing, and it was great to see your work presented internationally in Northern Ireland. So you're definitely making a mark out there and bringing this conversation uh, not only to a national conversation but a global, from people from around the globe, just really observing some of the work you're doing. So I want to say congratulations and thank you for everything that you're doing out there in the field.
Yeah, very kind words, and a mutual admiration society for you and Dr. English, who have supported not just me but the entire academic population at CGI to not fall prey to imposter syndrome, to put ourselves out
Hey,
there, and
that's not
that
English is
encouragement.
saying there, she don't play that. Yep, that's
Yeah,
exactly.
it means a lot. So I'm super excited, and just put in a plug here that I'm going to get to present on this topic in person at the North American ICIC up in Canada in October.
That's
So
right, October. Yeah.
hope to see you and anyone else listening there. But it's, as I said at the outset, just something I'm super passionate about, and very, very honored to have the privilege of speaking about it with you here in this forum.
Thank you. Thank you very much. And to our audience, thank you for joining us today. Please continue to join our podcast to learn some of the innovative things that are going out there in healthcare from various practitioners. And we thank you for just taking the time out to listen. Please like, share, and subscribe to our podcast. And we will see you at our next podcast. This podcast is brought to you by Cummings Graduate Institute for Behavioral Health Studies. CGI is celebrating 10 years of disrupting behavioral healthcare education to improve the way the world experiences healthcare.